Well, my twin brother and I, being what they refer to as war orphans because of our father's death, when we turned 21, received together about $25,000. We were the first investors in a company that Mom set up called Care Enterprises. And Care Enterprises grew to a pretty large company. Remember Mom coming up from California. We'd go up to her stepmother's place. Her dad had passed away, and she would leave $20, $50 in the bathroom. She didn't have $20 or $50, but that was her. I believe that part of Mom has rubbed off on us.
The foundation was created in 1999 by Lee and Dee Bangeter, who are twin brothers, who have worked in healthcare their entire lives.
It came from the Bangeter family's desire to be of service and has grown from that goal. How can we be of service to people who are in need?
We have several programs to help people. We have our Good Deeds Challenge, which goes into schools in our communities and gets children involved in giving back to their communities. Recently, we were participating with a local school, and these young kids got together and knitted hats for children at Primary Children's Hospital here in Salt Lake. We also have the Do Unto Others program.
They do these wonderful small things that you'd call your son to do: mow the grass or fix a fence that's fallen down. Not everyone has someone they can call. Many people do not. And it's a wonderful thing, not only for the people who receive, but I think also for the handymen who give.
And then the last program that we have is just our charitable healthcare funding program, to be able to provide essential healthcare services to people who are in need. Communities are doing their very best to try to address some of these needs and these gaps, but there's still gaps there. And we saw an opportunity by creating our foundation to help solve some of these community problems and find solutions to help.
I couldn't afford hearing aids and everything because it's pretty expensive for the hearing aids and stuff. It was hard growing up with having hearing aids that went in, that went around your ear. They would squeal all the time, and they were really bulky and big, and they were hurting my ears, and I got teased a lot when I was in middle school and stuff, and so I stopped wearing them. Being an adult now, I really don't care what people think or what kids think.
As a social worker, it's our instinct. We want to help. We want to be able to link them to whatever kind of resources or whatever type of things that they need. Rocky Mountain Care Foundation means that I have a door open where a lot of doors are closed. When they hear that we have an option, a foundation that they can apply to, the first reaction they often have is surprise. And then you can just see relief on their face, and they're so grateful.
So for someone who couldn't afford glasses otherwise, who maybe don't have insurance and they fall through that gap, they call the foundation, they get the glasses, and they can function better at work or just in their day-to-day lives.
I've tried, in all different ways, and they've helped me out a lot more than a lot of other people has even thought of. Without the help, it'd probably take me another year before I can even think about getting glasses.
One member of the marriage is totally bedridden, and the other one is 24/7 taking care of that. And every once in a while they need a break, but they don't have any money. That's where Rocky Mountain Care Foundation comes in.
My doctor actually has an accent, a really strong accent. And so for me, it's really hard to hear what she was saying and stuff. Even trying to read lips with her was hard. And so she's like, we've got to get you some hearing aids and stuff. There's got to be a way to get some hearing aids for you. And I wouldn't be where I am now if it wasn't for people that would donate. I couldn't even imagine my life without hearing aids now.
Every day we have the opportunity to help somebody that is at times desperate.
I can directly help someone. My efforts might actually be of real good to an individual.
Since then, I've been really blessed. I can hear everything. Noises and stuff I've never heard before, like crickets. And I'm like, what is that? What is that noise? What is that noise? It was really interesting to hear all these noises that I've never heard before.
The thing that moves me to get up every morning is Rocky Mountain Care. I love doing what I'm doing.
It doesn't matter how much you donate or, how little you donate. Everything's going to help somebody more than one way.
Small donations, $50, $100, $200, make a profound difference.
To help us help more people in our communities to fill in those gaps that oftentimes our government or insurance companies aren't able to fill.
I appreciate the people that do donate to the Rocky Mountain Care Foundation and to help out with people that need.
If they have a need, that's why you should give.